Here with me I have Dr. Rebecca Comley, Acting Medical Officer of Health, and Dr. Joanne Tober, BCHU CEO. Before we get started, could we please do a quick roll call for everyone joining us? Please state your name and affiliation.
Susan Gamble.
Berardi. Oh, sorry.
Hi, Patty. It's Susan
Hi,
Gamble
Susan.
from the Expositor and Patty Berardi from Rogers.
Hi, Patty and Susan.
Hello.
All right, and so prior to starting, we just kindly ask that you please self-mute your line to minimize any background noise. And as always, there'll be an opportunity to ask questions upon conclusion of the statement. And I'll turn things over to Dr. Comley now.
Thank you for joining us. I'd like to start by passing my condolences to the loved ones of the community members we lost recently to COVID-19. In our community, hospitalizations of those who are unvaccinated remain almost 5 times higher than those who are fully vaccinated. And ICU admissions are almost 6 times higher in those who are unvaccinated as well. This further confirms that COVID-19 still presents significant risks to those who are unvaccinated or those who are undervaccinated. Vaccines offer strong protection against severe outcomes from this variant. I continue to encourage anyone who is eligible to receive their first, second, or booster dose to not delay receiving it. Booking an appointment online through our website, walk in to one of our community clinics, or contact a participating pharmacy or doctor's office. Our vaccine teams continue to work tirelessly to ensure vaccines are accessible throughout our community via community immunization efforts. Our in-school clinics continue, and BCHU staff will be attending 10 schools this week. Vaccinations for 5 to 11-year-olds offer important protection for our children, our schools, and our families. I know that some parents have questions about vaccines and as a result may not have arranged their children to get vaccinated just yet. I encourage parents and caregivers to visit our Children and Youth Vaccine webpage to learn about the safety of vaccines and to contact a trusted healthcare provider to have their questions answered. Last week, NACI released recommendations surrounding the optimal interval for booster doses in vaccinated individuals who have recently become infected with COVID-19. New guidance suggests that vaccinated individuals who are eligible for a third dose should wait 3 months after the onset of symptoms following a positive COVID test. Individuals who experience a COVID-19 infection before starting or completing full primary series may receive their next dose 8 weeks after their infection. The time between COVID-19 infection and vaccine allows for circulating antibodies to decrease, avoiding immune interference, thus resulting in a better immune response when the vaccine is administered.
All right, thank you, Dr. Comley. We'll now open it up for questions.
Hey, it's Susan. I'm just wondering, we're still seeing first-time vaxxers kind of trickling into the clinics. I'm just wondering, are they treated any differently there? I mean, is there a party when a first-time person walks in, or does anyone even raise the issue with them?
No, at this point, because we are allowing walk-ins at all of our clinics, people are greeted and we're delighted to have them and happy to immunize them. Some of those people are ones who have more questions, so we do spend the time to have a discussion with them and answer all their questions while they're with us.
Do you promote asking questions at a clinic? I mean, are people welcome to come in and say, I'm hesitant and I would like to talk to somebody?
Yes, and we do have a call center that people can call us and talk to us and ask their questions that way. There are some references and resources on our website, and there's some lines. For example, Sick Children's has got a line that parents can call if they have questions about their children's immunization.
Interesting. We've seen a lot more deaths lately. It seems like the last 6 weeks have been almost really the worst in the whole pandemic. Is there any reason that you can pinpoint for that?
I would expect that that's because of the massive increase in number of cases. Because of that large increase in cases total, we're going to see more hospitalizations and deaths, and that's resulting from the Omicron wave.
And do you have any sense how many cases, real cases, we've had out there in the last month? Because as everyone knows, because of the reduced testing, we don't really have a good handle on how many cases are actually there.
It's true, because of our testing strategy has changed. Using our case numbers doesn't give us a real sense of the prevalence in the community anymore, and that's true. So we're following hospitalizations as one of our metrics for trend. We can also, we can also look at trends after the testing strategy changed, because that can help us decide what way things are going. So we do have to kind of pivot in the way we get information about prevalence in our community.
Isn't waiting until hospitalizations or ICU admissions kind of late in the game to try to figure out what's happening?
I think certainly I don't think we would necessarily wait for hospitalizations to go up. We would look at other markers as well. If we see our case positivity rate going up, that would be another marker. And so we would have to use it in concert with other things to try and get a sense of if we're seeing an uptick. Certainly provincially, wastewater can be a useful metric in a larger context as well, to look at trends over time.
And lastly for me, I'm just wondering, with the restrictions now being lifted somewhat, where people are allowed to maybe go more often into long-term care homes and eating out, things like that, gyms. Are you concerned? Are you cautiously optimistic that we're not going to go back into another wave? How are you feeling about this?
I'm expecting that we are going to see an uptick or an increase in prevalence because of the reopening. I think because we're being cautious, we're opening slowly, that's going to have a positive effect. The other big variable that's going to impact how significant that uptick is our booster dose rate. Because it's been very clear in the science thus far that getting a booster significantly decreases your risk of hospitalization in ICU. So if we can increase our booster dose rate, and that's specifically most importantly in the 50-plus population, because those are the ones highest risk, if we can increase our rate of people who've had a booster, that will definitely impact our hospitalization rate going forward. So in terms of what we want to be doing right now, one of our biggest goals right now is to encourage those who have yet to have a booster to go and get one as soon as they can, especially those who are 50 plus.
You must get tired of saying it.
I know. I agree with you. I think one of the things, though, it's important to reinforce that point, because we now have a bit of data on what's going to impact the Omicron wave going forward. And one of the things that has been shown is the effectiveness of the booster in improving outcomes for those higher risk individuals.
Okay, thank you.
No problem.
It's Patty from Rogers TV. I'm wondering, now that schools are reporting a percentage of absentees for staff and students, do you have any concerns right now? And certainly high schools, as of Friday, went back to 4 classes in regular semesters.
Do I have any concerns about?
Are you seeing high numbers of absenteeism within our classrooms and schools?
Okay, thanks for clarifying. That's why we continue to be in constant conversation with our school boards, and we're following the absentee rates closely with them. We don't anticipate doing dismissals like we did in the past, or certainly we don't anticipate that that's going to be one of our levers for change. I'm hopeful that thus far the numbers have been relatively stable, and we'll have to see with the cautious reopening that's occurring whether or not those numbers go up a little bit.
And I'm just curious of your thoughts on the vaccination passport. Now that Omicron has shown us that vaccinated people are getting it as well, do you still think it's a tool to have to prevent more cases, or do you think that it's kind of done its part in terms of getting more people to the plate to get vaccinated?
I think that the vaccine passport is a provincial decision, and I'm going to leave that in the hands of the province.
Okay, thank you.
Thanks.
That's it for me.
If I can just jump back in, it's Susan again.
Sure.
I'm wondering about the level of absenteeism in the schools. We've seen some that are over 30%, and I know that the province had said it should be 30% over the baseline absences, but it would seem to me that if you've got 30% of your school or 35% of your school that's away, likely because of Omicron, that shouldn't some measures be taken? If we're not going to use dismissals or closing the school, what kind of things can a school do?
A school can review some of their public health measures within the school to see if that's going to be helpful. They can also consider, and this is their decision, whether or not they want to modify their cohorting or change the amount of cohort mixing that occurs in the school. Those are some of the things that they can do should they see an absentee rate climb.